Lovie Smith confirmed it today. Jay Cutler sprained his left MCL. We're here in Grade II in yesterday's loss to the Packers. But what is that injury? What does Grade II mean? What is the likelihood he could have played through it? And for that, we welcome in Dr. Bernie Bach from Midwest Orthopedics at Rush. Thank you for being here.
Thanks, Dave. What
is a MCL sprain and what is a Grade II?
Okay. Well, the medial collateral ligament is one of the four ligaments that stabilize the knee. The medial collateral ligament, I'll show you this bone model, is on the inner side of the knee. And you can see that it's approximately 4 to 5 inches in length. When you sprain the ligament, in contrast to a strain, which involves muscles, a sprain is an injury to a ligament. Ligaments connect bone to bone. And when the medial collateral ligament is injured, usually the knee is struck from the outside and the knee springs open, as I'm depicting right here. A Grade II, there's Grade I, Grade II, and Grade III. Grade I means that on stress testing of the knee that it opens up somewhere less than 5 millimeters. A Grade II is somewhere between 6 and 10 millimeters, and a Grade III is more than 10 millimeters compared to the opposite knee.
And just so we're clear, we use the word sprain a lot, but the sprain is basically saying a tear, because the sprain is a tear.
That's correct, Dave.
Okay, because that's the confusing term for a lot of people.
Someone was telling me today, a friend of mine who's a radiologist, he said, imagine a thick rope. Some of the fibers tear. He said, if you have a complete tear, it's one of the few parts of your body that can regenerate, may not have to be surgically repaired, but this was not a complete tear.
Well, again, I'm relying on what I've heard secondhand as a Grade II medial collateral ligament sprain. It means that fibers of the ligament have been injured, that on clinical examination, this knee is unstable. It's the lead leg, the left leg, and I think you're going to have a very difficult time planting the foot to throw or even stepping away from taking a snap from center.
What will happen, looking beyond, the debate over his toughness is kind of, that's yesterday's news, literally. What will this mean going forward? How long, this injury during a season might be 2 to 6 or 8 weeks, possibly. How long before he can start back to the off-season activities? And will there be any carryover, say, by training camp, which would be in July? Will he be restricted when he does come back?
I would predict that he should not have any carryover whatsoever. This is a non-surgically treated injury that rarely is associated with meniscal or cartilage tears, and fortunately, from what we're hearing, he did not injure the anterior cruciate ligament. So with a Grade II injury, usually the patients will be supported in a long leg motion brace to protect the knee while the medial collateral ligament heals. Probably within a week to 10 days, this ligament will have tightened up on clinical examination. You're moving the knee as tolerated. You start physical therapy right away, working on swelling reduction, motion recovery, and strength. Usually with a Grade II medial collateral ligament, you might have to be even on crutches for 1 to 3 weeks, depending upon the patient's symptoms.
Now, he went to dinner last night, and I had friends who ran into him, and they said he was walking up the stairs at the restaurant, and he was not on crutches. What does that tell you? Anything?
Well, if he has a Grade II injury, he's tough. That's what I'd say.
There you have it.
So take yourself on the Bears sideline yesterday. You don't have the benefit of today's MRI that they took and maybe showed the Grade II tear. You're asking, the player for symptoms to describe it. You're feeling. What are you looking for? What are you hoping to hear? And how difficult is it to make the determination, okay, there's too much risk involved to put him back in the field?
Well, I think this diagnosis is a clinical diagnosis. The MRI reinforces the clinical diagnosis, and the clinical examination determines the grade of the injury. The Bears have great team physicians. Mark Bowen and Gordon Newber have been there with them for 15 years or longer. They do fantastic work for the organization. They know how to make this diagnosis, and they're providing sound judgment.
This, by the way, is, again, looking forward, just realizing this is his left knee, which is the knee he will come forward and his weight will go onto.
That's correct.
In your experience, will there be a psychological, because he's going to be, if his mechanics are good, which they haven't been, he's been throwing off the back foot too often, will there be a gun shyness that he'll have to overcome to where he feels comfortable coming forward and on a plant leg like this?
I don't think so. I think when this heals, he should have a very stable knee. He may, because of this injury, use a a brace to provide some stability, but I think there's going to, or to protect the knee like the linemen wear, but I think he's going to have a stable knee that is not going to be problematic.
Doctor, thank you for being here.
Thank you, David.
There you go.
Okay.